Scores of nurses arrived from Cuba to assist Barbados as the island records its second COVID-19 death. Local healthcare officials praised for their commitment amid the coronavirus pandemic. The Transport Board assures that services will continue for the time being. And in sports, a former BOA president charges that cycling is at the crossroads and needs urgent attention.
Broadcasting from our studios in the Pine St. Michael, this is CBC Newsnight, starting now.
Good evening, I'm Lisa Broom. Thanks for joining us. In our top story tonight, Barbados has recorded its second death from the COVID-19 virus. The 74-year-old man who tested positive for the viral illness on March 20th died this morning. His death comes one day after Minister of Health and Wellness Lieutenant Colonel Jeffrey Bostic announced the death of the first victim, an 81-year-old man. Health authorities have also disclosed 4 people tested positive for COVID-19 yesterday, bringing the total number who tested positive for the viral illness since March 16th to 60, 31 females and 29 males. Now, joining us tonight to discuss these latest developments is COVID-19 czar Richard Carter. Good night, Mr. Carter. Thanks for joining us.
My pleasure.
Now, we just got some figures as it relates to the latest numbers. Are there any more updates to those figures?
No, those figures represent the latest data that we have in terms of the number of COVID-19 cases. So the number stands at 60. We conducted a number of tests yesterday, and those tests came back, 4 of those tests came back positive. A 47-year-old female and an 84-year-old female, both tested at Paragon, at our Paragon facility. And then we have a 95-year-old male and a 57-year-old female, both presented at one of the polyclinics. The 57-year-old female is the daughter of the 95-year-old male. Okay. And the 74-year-old man who passed away, can you tell us any more about him? What else can you tell us about him? I don't have the details of his particular circumstances and cases. I believe those details would have been released by the chief medical officer. But it is representing a bit of a pattern that we've been seeing in terms of the number of cases that we've been seeing among the elderly. And in fact, Barbados's socio-demographic situation represents almost a perfect storm for COVID-19 and for adverse outcomes from COVID-19. Sorry to interrupt, but when you say socio-demographic, could you break that down for me, please? So the structure of our population, so we have a large proportion of elderly persons in our population. And of course, we know that elderly persons are much more likely to get really sick and unfortunately more likely to die. We also have among our population a large proportion who are suffering with non-communicable diseases. So hypertension and diabetes in our population are among the highest in the world. So the two of those factors together, the elderly in our population and the large proportion of persons with NCDs, does represent, as I said, a bit of a perfect storm for adverse outcomes. Now, outside of that, we were hearing, and I think you had started to address this earlier, business places have been talking about deliveries and making stock available, food stuff, vegetables, those types of things. Has any agreement been reached on that yet? Those discussions have been going on as of today. I was in a meeting of the subcommittee of cabinet with a number of the retailers and distributors discussing the best means by which we can meet the needs of the population, obviously for food, particularly as we go into the Easter weekend, but particularly also because there has been a period of restriction over the past couple of days. So we have 2 critical things to address. One, the obvious need to ensure that the population has access to food, and to do that in a way that is commercially appropriate. But secondly, to address the challenge of ensuring that we do not see a repeat of the scenes of chaos and basically people engaging in large crowds around the supermarkets. So meeting the public health requirements of physical distancing. And I see we have pulled up some of the one of the charts that I've prepared, which I want to address briefly. The blue in the chart represents the proportion of our population by age group, and the red numbers represent, or the red bars represent, the proportion of cases. And you can see that from the time we hit 50, 51 to 60, right through to 80 plus, the red bars exceed the blue bars. Basically what that is telling us that although 31% of the population of Barbados is over 50 years, we have seen 68% of the COVID-19 cases over 50 years. Now that is a situation of grave concern to us, because that population represents the population, as I said, that is more likely to fall ill and very ill and require medical treatment. They're the population that is also most likely to die. Now, we have, from the very beginning, put in place a number of measures to respond to the particular challenges of the elderly and persons with these conditions. We restricted from very early visits at the elderly care facilities. We also, a number of the business places, put in special hours for the retail sector for elderly persons to come and do their business either at the supermarkets or at the banks. And just over the past couple of days, we've introduced a number of passes for persons who are looking after elderly persons, providing care. But even here, we've seen abuse of this. We've seen persons approaching the Minister of People Empowerment and Elder Affairs, trying to get passes. And when the investigations are done, those have proven to be illegitimate, that persons are seeking to get these passes, not necessarily to look after elderly folk, but basically for whatever other means they have, representing the types of behavior that we've been asking persons to not to display, and that we've been asking persons not to show.
So since you have found people who have been trying to flout this, what punishment can be meted out to them, if any? The punishment, well, the immediate punishment will be that obviously they will not get the pass if they're found obviously not to be persons who are genuine. But the flouting of orders or the flouting of directives or the flouting of advice does not end there. I've seen the traffic on the road today and over the past couple of days, and you would not believe that Barbados is under a 24-hour curfew, with persons only supposed to be leaving their homes if they're going to do shopping or banking or stuff like that, picking up medication. And when you compare the roads of Barbados with the roads of big metropolitan cities, you see a completely different picture altogether. Let me ask you this. Is it a situation where people are not quite understanding the parameters within which the curfew is being carried out? You say, is it 8 to 6, 6 to 6, but you can come out after 6 a.m. So is it that it's a little bit confusing? People aren't getting it? Is there something more that needs to be said or done? No, people know what they're supposed to do. The advice was that this is a 24-hour curfew. You're only supposed to be leaving your home if you're going to the doctor for medical treatment, you're going to the gas station to fill up or to get a top-up, or you're going to do legitimate business. Let me ask you quick, what was the response to the call for volunteers?
We've had a positive response to the call for medical volunteers, and we are restricting that call for persons in the healthcare sector because we want to give a bit of respite and relief to our healthcare workers who've been working very long and very hard hours. The response has been very positive.
Can you tell us what is happening with the Trinidadians who are in quarantine?
The Trinidadians, I believe, would have ended their period of quarantine today, and therefore they would have discharged their responsibility from a public health perspective. Whatever they do after that is really their business and the business of the government of Trinidad, because essentially we would have covered our public health requirements in terms of maintaining them in quarantine over the 14-day period. Okay, I had one more question, but we have to wrap up, so hopefully we can get you back another time. My pleasure. Thank you very much. COVID-19 Czar Richard Carter here to talk to us about the latest as it relates to COVID-19 in Barbados. Now, some much-needed help is now available to Barbados as it continues to battle against COVID-19. It comes in the form of 100 Cuban nurses who arrived here last night. We hear more in this report.
The team, which arrived at the Grantley Adams International Airport, is made up of intensive care specialists. They will be providing respite care and support to local medical teams on the front line of treating COVID-19 positive patients. They were greeted upon arrival by several officials, including Health Minister Lieutenant Colonel Jeffrey Bostic and Barbados' Ambassador to CARICOM, David Commichon. Earlier today, the health professionals visited the Cuban monument in Paynes Bay, St. James, where they reflected on the lives lost on October 6, 1976, as a result of the bombing of the Cubana airline Flight 455. Accompanying the team was Executive Chairman of the Queen Elizabeth Hospital, Juliet Bino Sutherland. She explains the Cuban nurses will be deployed as soon as they can be rostered to isolation facilities in need of nursing staff.
Our nursing department and the managers of the various wards and units are literally scratching their heads on occasion trying to figure out how they can make their numbers work and still provide effective patient care. These Cuban nurses deployed to the isolation center will provide us the opportunity to recall some of our staff that are now working elsewhere. And because they have worked in isolation and other initiatives, they're ready and well poised to be able to function effectively in the isolation setting. So we're extremely pleased about their arrival.
Barbados' Ambassador to CARICOM, David Commichon, was also on hand. He thanked the nurses for their invaluable service on behalf of the people and government of Barbados.
When the history of this period is written, that the world will see that the people of the Caribbean, led by our Cuban brothers and sisters, conducido por nuestros hermanos y hermanas cubanos, wrote one of the most shining chapters escribieron uno de los más brillantes capítulos in the history of humanity.
So far, medical teams from Cuba have been welcomed in at least 14 other countries across the globe as the fight against COVID-19 continues. Lorna Jones, CBC News.
Lorna, thank you. And we're joined now by the infectious diseases specialist at the Queen Elizabeth Hospital, Dr. Corey Ford, who is going to give us now some more detailed about some of the patients that we have who are being treated for COVID-19. Dr. Ford, thank you very much for joining us.
Thank you. It's a pleasure to be here.
So patients in isolation, what can you tell us about them?
Yeah, so we currently have 52 patients in isolation. Unfortunately, today, as been announced, we've had one further death, and we give our sympathy to the family. And many of the healthcare workers have been impacted by this. Currently, as well, in our facilities across the country, I just need to mention a few clear things. With regards to the majority of the patients that we have in isolation, we're quite concerned because a lot of them are in the elderly population. And as we know from across the globe in this particular outbreak, we're having a lot of deaths within that particular population. We as healthcare professionals have worked extremely hard, even though people have come in these populations and people have been quite well, unwell in those age groups. We have worked pretty hard in that area. What I would say in regards to our patient today is that he was an elderly patient with many other comorbidities as well. And I think due to the work of the Ministry of Health, he was actually found because of the screening programs which we've had. So we're able to track and find him within the population. But more importantly, we have at the Enmore facility, we manage people who are ventilated, who are obviously very ill. And then we have, of course, at the Blackman and Gollop facility, for example, two sections. So one where we have people who are unwell but don't require ventilation. And then we have another section with people who are quite like me or you. What I want to mention particularly is in that particular section at Blackman and Gollop is one where we have a more elderly population who are quite ill. Mm-hmm. And specifically, one of the patients there at present is actually quite ill, mm-hmm. which we are managing at this particular point mm-hmm. and venture. I think it's important at the end of this to say that for the average Barbadian to understand a few facts. Given the trajectory of this disease and what we have seen internationally, we're quite concerned about our elderly population, and it's very, very important that every single Barbadian looks after those persons in the elderly population. So there may be people in your neighborhood, in your community, that you actually look after them, see what's going on. But also the caregivers. So the caregivers, if you know you're unwell or you have respiratory illnesses, it's important that you don't just go to visit, but you take care of that.
So take care of yourself.
Take care of yourself. Take care of yourself, but also take care of the people around you.
Also, let me ask you this, Dr. Ford. When we were talking earlier, you said you were concerned about how late some people were presenting as well. That is a major issue.
Yeah, it is a major issue because I think the later, if you look at our cases who are presenting more severe, the later you present, the greater the propensity for you to have a worse presentation or worse outcome.
So this is why people need to look in on the elderly more often.
They need to look in on the elderly, but I'll go a little bit further than this. I mean, the Barbadian culture is, if my mother has to go off to work, for example, and there are kids around, for example, they may have a snotty nose and cold, and you're not really sure what they have. The often thing to do is to send them to the grandparents. But one needs to relook at that in this particular event. I think this whole COVID-19 pandemic has taught us several things, and this is some of the small things that we need to look at. So people are obviously advised, you know, if you have the elderly population, you see they're unwell, try to present for medical care quite earlier, as opposed to wait for much later, because the presentations by that time are often quite difficult. People often have severe pneumonia and damage to their lungs, which makes things much more complicated for us.
Now, something you said as well earlier, that some of the cases presented at the polyclinics.
Yes.
That is what is supposed to happen.
Yes.
Is it?
So at the segment of the polyclinic, some patients will be sent there for early swabbing for identification, and they'll often wait for the results, or if they're well enough, they can go home and we'll get those results and contact them and put them into isolation as so desired. So I think overall, every single Barbadian has their role to play, and particularly within the elderly population, we have a distinctive role to play out there in the community. And I challenge every Barbadian as we go through this outbreak to stay at home, stay in, as is requested by all the healthcare professionals, but also look after the less fortunate persons around us in the community.
My last quick question, were you able to trace anybody who came into contact with the 81-year-old who passed away?
Yes, so we're still in the process of tracing, but we were able, I should mention pretty quickly, that we were able to find for the unfortunate person who died today, we were able to find the source of his infection, which was a traveler coming in from the US, which he was directly related to. She came in and she was one of the most sickest patients that we've seen very early in the disease, and I'm happy to say today that she's walking around and well at Batman Gollop.
Well, thank God to hear that.
Yeah.
Thank you very much, Dr. Corey Ford, the head of infectious diseases program at the Queen Elizabeth Hospital, there speaking with us. Prime Minister Mia Amor-Motley has issued a heartfelt thank you to the country's healthcare workers. She expressed her gratitude during a brief social media video recorded at her residence as she recovers from a major surgery. Ms. Motley says she's especially moved by the quality of healthcare provided by healthcare workers, having had the opportunity to interact with a number of them over the past week. She, however, acknowledged it had been a difficult day for many of them as Barbados recorded its first COVID-19 related death.
I want to reach out to his family as well, because death is not easy in whatever form that it comes. But as the first in this dreaded COVID-19 virus is particularly touching. In addition to that, we can, however, recognize that you have helped us allow the first 6 Barbadians to be able to move out and to move to the next level. And that could only have happened with your extraordinary sense of care and duty and devotion and skill. And I want to salute you for that and to let you know that we are paying absolute notice. Now is not the time, but I want to assure you that when this is all over, that we will have, in a very major way, an appreciable form of saying thank you to you.
The Prime Minister has also called on Barbadians to do their part so they don't put additional pressure on healthcare workers by taking the necessary steps to protect themselves from contracting COVID-19.
And also by ensuring that we leave the really vital masks, the N95 and the surgical mask, and the ones that are being done as flash guards almost, for you, because you are the ones on the front line. And believe you me, we will do whatever is necessary to help you. I particularly am even more moved because obviously in the last week I've had the opportunity to interact with a large number of you, and I've said to everyone who has asked me how do I feel and how was it, that the care could only be equaled, not bettered.
Well, no decision has been taken at this time to end bus services at the Transport Board. There have been reports the board has been planning to stop services by the end of this week. But in an interview with CBC News, Chief Executive Officer Fabian Wharton says they will allow bus services to continue for now.
The original thinking was that we will use shuttle services for all of the essential services. But we know we still have one or two persons. We have persons that may, move around to take care of the family or whatever the case may be. So we are giving some more consideration into it. So I think that decision now is going to be put on hold. So we will continue as per normal. Any further adjustments, we will notify the public. As it stands now, we will do the shuttling for essential services, and we will continue to run services across the network.
Health officials in Barbados are no longer advising against the wearing of face masks during the COVID-19 pandemic. Acting Chief Medical Officer Dr. Anton Best admits that up until recently, the ministry was not in favor of the general public wearing masks. However, the Center for Disease Control and Prevention in the United States has now taken a position of no objection. The ministry has followed suit by amending its position.
We are not objecting to the general public wearing masks. However, we do not want the general public buying the medical masks, and that's the N95 mask and the surgical masks. Those can only be used or should only be used in healthcare settings. So we do allow for persons to use the cloth masks.
President of the Wayside Vendors Business Association, Keith Franklin, is hoping measures could soon be implemented to help vendors who have excess produce on their hands. He says many are now stuck with the items as vending is prohibited under the new Emergency Management COVID-19 curfew.
We hope that things will get put in place as soon as possible, that we could sell off our produce and to get the plague that about the place control. You can't tell the value back. You understand? Because sometimes we only know the value when we done do the business, and to get the money coming in, you know the value back. I can't tell you the value right now, but I hope that everything put in place that we will lose as much as we, don't be dumping.
Over the weekend, cell phones and computer screens in Barbados were buzzing with a viral video from Sherburne in St. John showing residents openly venting their frustration over what they're saying has been months without consistent water supply to the area. Well, this morning, CBC News traveled to the water-scarce district to hear more from the residents and found St. John MP Charles Griffith among them. CBC's Shane Jones reports.
While Barbados and the world are still struggling to come to terms with the deadly COVID-19 virus, the small community of Sherburne in St. John has an additional problem. It has serious water issues. When we got there, the good news was that tankers were servicing the area and people were able to get some water. Some of the residents explained what they were going through.
Me being an essential worker, have to be outside there to the elements. You need to clean yourself when you come home, clean your clothes, because you can't just bring whatever you are picking up into your home and then you don't have water to clean yourself.
In general, we get the tankers come around every day and we get a supply of water, but the issue really is getting water at the taps. If we could get water at the taps at least once or twice a week, that would really help.
What I'm really doing here is try to get these 2 extra cans to get water in to do some like washing up, clean them up to get water to wash up, flush toilets and stuff like that. Because when it comes to the truck, unless somebody's here with me or on the other side of the road, my family, I can't get water because I have a bad back.
The minds of the people are beginning to feel the frustration almost daily now. It's a real grind to actually be making constant trips to the water tank when there's water, and then to the water truck, which happens to be here today.
MP for the area, Charles Griffith, was on the scene listening to the residents vent and conversing with them about the issues they are having. He also had a few words with one of the drivers of the BWA's tankers. The St. John MP acknowledged there is a major problem in the area. He says while he knows the reason for the issue is because of a low reservoir, he feels the frustration of his constituents.
Not having water coming through the taps on a regular basis when you turn every morning is a problem. I know that the Barbados government, the Barbados Water Authority, are working assiduously to rectify the problem. I am having problems in St. John with not only Sherburne. In Sherburne, the problem is very acute, but we also have issues in Gall Hill, we have issues in Port House, we have issues in Carters, we have issues in Glebe.
The MP made a plea to the BWA to continue working to improve conditions in St. John.
I saw a video on social media that went viral with persons from here in Sherburne that are very, very irate, and maybe rightfully so, about the fact that water is not flowing through the taps, that there was a promise of water on Monday, Wednesday, Friday, and that is not happening. And if there's a situation at all that we can have water maybe in the morning running in Sherburne and the other communities in St. John, that would go a long way to alleviate the problems of persons that are living within these communities.
Mr. Griffith said there have been complaints of some residents using the water from the tanks to wash their cars, and he pleaded with them to desist from doing so. Shane Jones, CBC News.
Thanks, Shane. And still to come, concern about the state of cycling in Barbados. The elderly in Jamaica ordered to limit their movements as well. But before we get to all of that, here is a tip from Cooperators General Insurance.
This tip of the day is brought to you by Cooperators General Insurance Company Limited. Insurance the way you want it to be.
If a person is hard of hearing, make sure you're facing them. Don't cover your mouth or speak with your back turned. This tip is brought to you in association with the Barbados Council for the Disabled, helping to sensitize and inform the public.
Dr. Judson Ennias is the first physician to die from the coronavirus in the Bahamas. The 72-year-old's death marks the fifth COVID-19 related death in the country.
Dr. Ennias, a well-known internal medicine specialist and nephrologist, was confirmed positive in a Ministry of Health statement on Wednesday, April 1st. The following day, Thursday, April 2nd, the Ministry of Health revealed that case number 18, who we now know to be Dr. Ennias, had been hospitalized in intensive care. Last night, just 2 days later, he died. Well, condolences pouring in for Dr. Ennias, who is being hailed as a towering figure in the medical community. Progressive Liberal Party leader Philip Davis called Dr. Ennias a man of all seasons, a national treasure, and a son of the soil who loved the Bahamas deeply. He said his expansive civic work helped to shape a generation of young Bahamian leaders and significantly strengthened our country's social fabric.
With restrictions now in full effect in Jamaica to contain the spread of COVID-19, the elderly have been ordered to limit their movements. We hear in this CVM-TV report how some have been coping with the stringent measures.
Jamaicans 75 years and older have been ordered to stay at home as the government tightens its restrictions on gatherings to contain the spread of COVID-19. Their age group identified to be at a higher risk of dying from the virus, which has affected millions globally and killed thousands. The order from the government means a change in routine and practices that many now have to give up.
Well, I used to go out and do things for myself. But from the virus, I can't go out because they said the elderly must stay in. So I try to stay in and ask somebody to do it for me, do things for me.
She says sometimes it is difficult to find someone to run errands.
Well, this developing story now. Lawmen are currently carrying out investigations into the shooting death of a Barbados Defence Force soldier. Police Public Relations Officer Acting Inspector Rodney Innes was only able to confirm for CBC News the incident occurred sometime this afternoon on the compound of the task force at the District A Police Complex. No further details are available at this time.